TheSmartLocal.com.
Whoa!
Hi everyone, I'm Xenia and welcome back to Hired or Fired Season 2. Now that you have Xenia 2.0 attempting a new series of exciting yet challenging occupations, let's hope I get hired more. And in this episode, I am going to be a nurse for a day. My first impression of nurses is that they are very patient and compassionate people. I actually have a lot of experiences with nurses because last year I had my appendicitis surgery and my late grandma was in and out of the hospital for 3 years. Yet I don't think I actually know what they do. If I have to guess, I think their main job scope is to listen to doctors' instruction and take care of patients by their beds. That doesn't sound too scary to me. It's 7 a.m. now and it's time to get to work.
My name is Ken Kwang. I'm the Chief Nurse of Tan Tock Seng Hospital. My role as a Chief Nurse, we take care of resources, training, standards, policies. So I oversee that to make sure that we work with the relevant partners within the hospital to make sure that the work environment is suitable for the nurse to give the best care. As a nurse, I find it very satisfying. There are patients who connect better with male nurses. And I remember one particularly who appreciated the care that I provided for him. Even before he left, he thanked me. Nurses can make an impact on the people they care for. One of the things that I'm looking up is nurses are more involved in decision making now. So advanced practice nurse has been granted the rights legally to prescribe medicine. So I'm really happy for how the profession has grown. Looking forward to see how it will progress over the next few years.
Good morning, Mr. Yong. I'm Xenia.
Good morning, I'm Ken Kwang, Chief Nurse at Tan Tock Seng Hospital.
Nice to meet you. I just want to know what is my task for today.
You will have a chance to feel what it feels like to be a trainee nurse today. So you'll be getting to do medication administration, clinical rounds, assessing vital signs, as well as assessing for abnormalities for the patients under your care.
Okay.
And most important of all, you'll be evaluated for your life support skills.
So it's a test.
It is!
They don't like to tell me this kind of thing and like surprise me on the spot.
So Xenia, are you ready?
Of course, as always, I am ready.
In that case, this is a uniform that will get you going.
Okay.
Good luck and have a good experience.
Okay, thank you. And let's go get changed.
I'm Mira and I'm a staff nurse here in Ward 9A. Hi Xenia!
Hello again!
Hi! So today we will be in Ward 9A for the whole day to complete a few tasks that we have already planned out for you. So since you have done your pre-training, so do you think you're ready?
I hope so. What's the first task for me?
Before we do any task, we need to do the roll call. Basically, the roll call is when the staff nurses from the night shift hands over the case to the morning shift so that there is a continuity of care. So after that, then we'll be doing our medication rounds and then it will be the clinical rounds.
Okay.
Yes.
It sounds easy to understand, but I don't know what that entails, but I'm sure you'll help me.
Yes, I'll help you out. Don't worry.
Let's go!
Let's go!
Okay, good morning everybody. DIL max SWOT bed 8 and 19. Non-DIL max SWOT is bed 7. In I is as ordered and 1C for fasting blood. Then ONS so far is only 1, 30A. Then nocturnal is 7:30 to 12, then 1 to 5 PM lah. That's all.
Thank you. So Mira, I was paying attention, I swear I was listening very attentively, but I couldn't catch anything. I just couldn't really understand.
I think it's the terms and the short forms and
correct.
abbreviations.
You have to go through like education to learn like the nursing language and how you communicate efficiently. The roll call was so fast because everybody have to be on your feet and ready to hand over properly because these are people's lives. Now moving on to the second part, I hope I don't have to learn as much lingo.
Maybe not the lingo, but there's a lot of steps that you need to learn.
Okay.
Yeah.
And that is
Medication administration. Yeah.
There you go.
Yes.
Let's go.
Okay, Xenia. So this is the Omnizel. This was what we did yesterday. So I hope you remember what I've taught you.
Yes.
Today we are going to pick the meds for Mr. Woo with the OM. Those OM means?
On morning.
Yeah.
I gotta do my homework.
TDS is?
I learned TMD.
TDS means 3 times a day, so it's in the morning, afternoon, and
I
in the
thought
evening
TMD
time.
was 3 times a day.
TDS. Okay, so
Right, TMD.
Okay, now we find the flashing light and then it will say 3 taps. 1, 2, 3.
it's okay. You can just stay at the bottom part. It's okay.
One job.
Okay, hold on.
We will just go over to the patient and ask whether he needs a PRN doses. And then
PRN meaning?
as and when necessary.
Oh.
Yeah.
I'm gonna start using these terms to make myself look smarter. Hey, just pass me back the camera. PRN ah. Get it?
Don't know, right?
Before we even dispense the medication, so I hope you remember the 5 rights and the 3 checks that I mentioned earlier yesterday.
Yes, the right patient, the right time, the right drug, right dose,
The
and
right
route.
route.
So we start taking out one by one.
Yeah.
First is lanthanum.
So you have to scan first. Can?
Sorry, again. NG. Toot.
It's a bit hard to scan. Ah.
Right, I bet you didn't know. Okay, check. Expiry date again, not expired. It is Mr. Woo's.
So what does it
1000 mg.
Okay, let's go and head to the patient.
Hi, Mr. Woo.
So,
There we go.
okay. So our job doesn't end there. We have to explain to him the medication as well. So, Mr. Woo, so there is your lanthanum inside as well as your calcium carbonate. This one you have to take it with meals. So, if you feel uncomfortable at any time, or feel your pain is increasing, just let us know.
Yeah, sure, no problem.
Can, thank you.
Hi, Mr. Woo. How are you feeling? Uncomfortable. Which part is uncomfortable?
Want to vomit.
Vomit ah.
Lots of appetite.
Okay.
Then you see now like sweating like that, like very warm like that.
Okay.
Yeah, we'll bring up to the doctor to see whether he can give you any medication to help with your nausea vomiting. Thank you, Mr.
Okay,
Woo.
thank you.
So Xenia, now that we have already assessed the patient with his nauseous, so we're just going to check the medication records to see whether he has the medicine. If not, we are going to highlight this to Dr. Eric.
Okay.
So we will proceed over to this. The anti-nauseating medicine that the doctor always ordered is called Maxalon. So we can see that the patient does not have this medication here. So we have to bring it up to the doctor to order some of these medications for the patient.
Okay.
Alright. So now we're moving on to the last part of your first task, which is clinical rounds. So basically for the clinical rounds, we'll just be following the doctor's rounds and also updating about the patient's condition. Let's meet the doctor.
Hi, Dr. Eric.
Hello.
We just finished an assessment for patient Wu, and he informed us that he feels a bit nauseous and also there's a loss in appetite.
We checked that there was no Maxalon that is ordered previously because I think this is the first episode that he's experiencing.
I can order a PRN Maxalon so that he don't feel so nauseated. Refer him for dietitian.
Yeah.
Update me again if he still has loss of appetite for maybe 2 days.
Okay, thank you, Dr. Eric.
Alright, welcome. Alright.
So now since Mr. Johari has come back from his treatment, so we're
Yeah.
just going to check his CBG before we give him his food. Hi. Hello. Cik, we're going to check your sugar before we give you your medicine, okay?
Mr. Johari, you feeling good? Good.
Which finger? This finger, okay. So now we see whether he requires the insulin or not. Mr. Johari, you need to give 2 units of insulin before you makan, okay? Can? Okay, so 2 units. Okay, inject it. Okay, take a deep breath, Okay, done.
Thank you, Mr. Johari.
She damn cute.
I think I see old people like, yeah, I think I'm my mom. Just want them to feel better and like get discharged. I think the fact that like he's still so happy, then like got talk. Then I feel very happy. Damn lame, I just meet him one day only like that. I hope we don't put that inside.
We know we will.
So now we have completed our first task. What do you think?
I never knew that a simple task of dispensing the medicine to patients requires so many necessary steps. You have to make sure you give the right medicine, the right dosage to the right patients to keep them safe.
Hello Xenia, I'm Benjamin here. I'm a senior staff nurse from TheSmartLocal Hospital. I believe that you are doing your task 2 today, which is performing patient's assessment. Shall we go?
Okay.
Let's go.
Hi, Mr. Wu. I'm going to take your blood pressure. 吃饱了吗？
吃饱了。
吃饱了。Okay. It's gonna be a bit tight, but okay one, huh?
Okay, so
Okay.
just make sure the line is actually at in front.
Okay,
So you see,
can.
this thing is actually, this part must be at the patient's side itself.
Sorry, Mr. Wu. Turn it on.
SPO2.
Oh,
This part. This part.
oh okay. Your pulse, so Mr. Wu, your pulse rate is 110 per minute. That's a bit high, but I think it's fine.
We'll check the baseline first.
We'll check the baseline later. And the percentage of oxygen in your blood is 100%, and that's great. We will check your baseline and let you know.
So you can see actually Mr. Wu's baseline is actually hovering around 140 to 170. Just now was 100 and?
54.
Yes, that's right.
So there's nothing to be alarmed about.
That's right.
Hi, Mr. Wu. We checked your vital signs. Everything is within your baseline, so there's nothing to be worried about.
Okay.
Yeah. You're feeling okay? Do you have any questions?
No, I'm pretty fine.
Okay.
Thank you so much, Mr. Wu.
Thank you.
Thank you.
Rest well.
Okay, Xenia, we have another patient for you to actually take the blood pressure.
I can do better this time.
Come, let's go.
Let's go. SPO2, SPO2, Xenia, SPO2. Hi, Mr. Uday. How are you?
Okay.
Okay. Yeah, Mr. Uday, I'm Xenia. I'm going to take your blood pressure. Is that okay?
Yeah, no problem.
Okay, no problem. Have you eaten?
Yeah.
Okay.
Thank you.
Put it on this hand. You flip for me. Yeah, great.
Very good.
There you go.
But this one is a documentary, yeah.
No, this one my first day of work.
Oh.
I trying to be a nurse. Later you tell me whether I good or not, okay? So Mr. Uday, we are gonna go and check your baseline, then get back to you and let you know whether there's anything to be worried about, okay?
Okay.
Okay. Mr. Uday, do you feel any pain?
No.
No? Yay! Happy to see you so happy. His baseline is 145,
Yeah, okay, 2.
185,
Yes, that's right. And just now the reading was?
178.
That's right.
So there's nothing to be worried about.
And patient looks generally?
Fine.
Yep.
And there is no pain, no discomfort. Hi, Mr. Uday. We checked your baseline. Everything is great.
Oh, that's nice.
Yeah, nothing to be worried about. So am I a good nurse?
Still have to practice more.
Still have to see.
The nurses here, they can do all the checking, you see.
Very fast.
So that's why you practice
Yeah.
more.
Okay, yeah. Okay, I will practice more and be faster next time. Thank you, Mr. Uday.
Okay.
You can tell actually you are more confident now.
Yeah.
And you know what you are doing. Even though it can be very routine and monotonous,
Right.
but at the back of our head, this is what we are processing. Whether it's normal and all this is step-by-step algorithm.
I guess I'm on to my last task. Wish me luck.
Okay, all the best.
Thank you.
All the best. Take care. Okay.
Good afternoon, Xenia. How are you today?
I feel a bit overwhelmed, but the good thing is I feel like I'm learning a lot today.
So for the last task for today, we will incorporate everything you have learned and we'll put you to the test in this life support course assessment.
I feel like I've revised enough and I paid full attention and I'm confident.
Okay, are you ready?
Of course!
Okay, let's go.
Hello, are you okay?
Hello, are you okay? No response, nice, code blue. Help, code blue. No pulse. Okay, Ben, take over the CPR. Mira, please help me with the bagging.
Applying pads. Analyzing.
Don't touch patient.
Shock advised.
Okay, stand clear.
Shock
Okay, Ben, continue the CPR and Mira continue bagging. Okay, I'm going to analyze. Don't touch the patient.
No shock advised. Check patient.
Pulse present. Reading present. Okay, I'm going to take vital signs. Let's give the patient some oxygen. And then we'll do a continued vital signs monitoring. Inform the doctor as well.
Oh no, he's unresponsive. Hello, are you okay? Talk to me.
No response.
No response. No response. Oh shit. Code blue. Oh wait. Now I need to take this down. Oh no. Not take out clothes first.
Can take out the pillow first?
Oh, take out the pillow. Sorry. Okay.
Okay, tilt the head a little bit more because you want to open up the airway.
Sorry. No breathing. No pulse. One and two and three and four and five. 1 and 2 and 3 and 4 and
10.
Okay, Xenia, your friends are here.
Okay, CPR. Okay. Okay, I'm gonna turn on the AED. Do not touch the patient. Okay, everybody stay clear. Don't lean on the bed.
Shock delivered.
Okay, Mira, please continue CPR 2 minutes and continue begging Ben.
Analyzing.
Oh, do not touch patient. Oh, sorry, it's past 2 minutes first, huh? Okay, I'm gonna analyze now.
Shock advised. Shock delivered.
Oh, thank you. Oh, shit.
I'm going to stop for a while. There are a few things which we will need to improve on. Okay, the first thing is the wires here are a bit tangled and I need help a little bit. When you go to the AED, the stand clear must be right before you press the shock button.
Okay.
Another thing which I like from you is that when you were checking for the respiration, you're actually looking at the rise and fall of the chest to make sure that the patient is breathing or not.
I think I was just looking at the neck. I can't imagine if this is just a mannequin and I'm already so flustered, how would I react if it's a real human being?
It's not every day that a patient collapses, but we must know that if the patient collapses, we will know what to do because it really saves a life.
Yeah.
Okay, Xenia, so now that you've completed the whole entire day in Ward 9A, what do you think?
I think it has been a very hectic day. I always see like people rolling the trolley around, the lights are blinking, there's sound, and the patient is coughing and you need to attend to them. Must always be very alert. And I also learned something about myself that I thought I follow instructions pretty well. Turns out, no! SPO2, Xenia! And I finally figured out why. And that is because I don't know the terms.
Right.
And I don't have that knowledge. So I'm just memorizing.
Some of the things that we as nurses learn is also through the job. That is when you really know what is the difference between like normal, abnormal. It's not textbook based. It's like case by case basis.
Right. I feel like many people think that being a nurse is always just very hands-on. But for them to do the hands-on things very perfectly is because they've been through theoretical training. It's not anyhow one, you know.
It's like a merge.
Yeah.
Of both. Yeah.
So this is where we have the big reveal.
Okay.
Of would you hire or fire me? But don't tell me first. Season 2, we're gonna do something different. We're gonna review together. So you're gonna tell me your answer, and I'm gonna guess whether I'll be hired or fired. Okay, you turn there. You cannot look at me. My heart like budum. I think the heart rate is irregular. AD.
Okay. 1, 2, 3. I really feel that you have the compassion and the soft skills that is needed by a nurse. Nursing, we are a profession where we use our soft skills, our compassion and the attitude, and we always put the patients first. So I think on that part, you were really excellent in that.
Oh, thank you.
Yeah.
Well, I thought I was gonna be fired because only today then I realized that it's just so much more than just taking care of someone by their beds. It's not something that you can achieve in a day. You just have to go through years of training. Thank you. Mr. Ude, I'm gonna take your high blood pressure. I'm gonna take your blood pressure tomorrow. Sorry. So I've ended my shift, but I'm gonna start with this one thing that I really like, and that is the culture. Nurses are not only helping patients every day, they are always working as a team with fellow nurses and doctors, and that's a kampong spirit that is so hard to find in the working world today. What stood out the most for me was actually my conversation with Ben. He shared with me how he followed his passion despite judgment from his own family due to the stereotype that nurse is a female profession, broke the stereotype, and now he is doing what he loved every single day for 6 years counting. He also shared with me how watching his patient find the will to live again after losing his right leg at the age of 25 brought him a kind of happiness that money can't buy. For many, being here, battling with an illness, going through a surgery, recovering from an accident could easily be the lowest point in their lives. And I remember when I had my surgery, I couldn't stand at all. The nurse had to put out my pants for me to pee and they had to shower me. That was when I felt most vulnerable. And what makes this occupation so special and noble is that there's so much you can do to change someone's life for the better. Thank you to the Care to Go Beyond campaign for making this video possible. To find out more about nursing, visit the Care to Go Beyond platforms in the video description below. Thank you for watching yet another episode of Hired or Fired. If you like this video, remember to like, share, subscribe, and watch our other videos there. Bye!